And welcome back, welcome back. Let's welcome our guest, Mr. Michael Stewart, who we are going to speak to via virtually. And of course, Michael Stewart, well known for his motivational speech. He is the founder and leader of Be Men. And of course, we are going to speak about our men's health, given that this month is Men's Health Month. Mental health also, well, of course, mental health as well. All right, so let's bring Mr. Stewart. Good morning and welcome.
Good morning, Brother B.
All right, we're not hearing, so we'll get you up in a minute, and we'll have you. Yeah, let's try again. Good morning.
Okay, good morning. Are you hearing
All right,
me?
still. And we are going to get into that whole question of men's, how men are affected by so many health issues. Let's try again. Good morning.
Hi, good morning. Good morning.
Very good. All right, so just bring up the volume a little bit and we'll be okay. All right, let's get into it. All right. The statistic has shown that a number of men are taking their lives for some reason or the other. And of course, we label that as part of the mental health problems that men are going through. Let's touch on mental health first, and then we get into other challenges with health issues that men have to be confronted with. Mental health, Mrs. Stewart.
All right, Brother B, I think the people in the mental health aspect would speak more directly to that, but you did intimate to the kind of suicide that's taking place among our men, which shows that there is a mental health challenge that we are having, how men go through stress. I don't know if you're all aware that the statistics, I will give you a US statistic that said that 18,395 males live in homes that they don't have a stepfather, no adoptive father, no biological father, and 85% of them are in prison. Of the persons who are in prison, the 85% of them are youth. So when it comes to suicide, it is alarming that in the United Kingdom, 92% of men actually take their lives even while they are getting help. And 80% of them are low risk for suicide, but yet committing suicide, which means they're not destitute people. And that we've seen in Trinidad and Tobago, many of these people have been in very good jobs, come from fairly good homes, etc. So that must say something that is going on in our society. And the fact that he could say that every 40 seconds, you have a suicide that is taking place worldwide, and most of them are men. So clearly there's a mental health challenge that we have to consider.
And what, in your view, would contribute, and let's stay locally and maybe regionally to some extent, what are some of the contributing factors? I mean, in some cases, they do have indicators that this fella is suicide prone. However, sometimes it is ignored. In some cases, they may leave a note. And they are the only ones who are going through their pain, Mr. Stewart. What are some of the contributing factors from a statistic standpoint?
Well, I think the relationships that some men experience or fail to experience in the romantic life happens to be one of it. And I think a growing effort and a growing indicator is the relationship with the child's mother. I will give you two critical examples. I got a call from a gentleman, and his lady was preventing him from seeing his child. He has had a child with her for 3 years, and he loves the child very much. Because of an indiscretion of his, he was unfaithful. She blocked him from ever seeing the child, and he begged to continue to see the child. But she would not relent because she felt that it was really inappropriate for him to have done what he did, and agreeably so. But preventing him from seeing the child was a bit difficult. Yet, in his effort now to get back to see the child, he did a paternity test and found out that the child was not his. Yet she was blocking him and preventing him from seeing his own child because of his unfaithfulness. And now that had a mental impact upon him. He was devastated. He was broken. So both of them are culpable in this case. another case is that we see in the court system there is also there is little empathy for a man wanting to see his child, for those who do want him. So I agree that there are some men who are delinquent, but there are some men who want to be part of their children's lives. And a gentleman, I am aware, he was maintaining his child and maintaining his child well, but he was not keeping record. He was not taking a receipt, etc. And she left the marital home, and after having left, was advised by her friends to take the man to court for maintenance, even though he was maintaining it, thinking that she could exact more money from him than he was already giving. When it went to court, the court awarded a sum that was much less than he was giving her by cash without the records. And his lawyer suggested him, boy, pay the amount the court says it, because now she has lost in the fact that she's getting less. But he insisted that let me give my child what I was given all the time, because this is my child. A court should not tell me how much to give my child. He said, I want my child to live the best life that the child can, and he's going to give the kind of support that he can. But the court system itself sometimes goes against the man when the court gives the woman automatic charge of the child without taking into consideration these things. This is one of the things where the man came out more or less with the support of the court. But there are times where the court actually goes against the man almost automatically without thinking. Also with issues of accusation of violence, he's put out of his home. So those are the things that bear down heavily upon a man's mental state and how he feels about himself, and whether he gets any support and where does he get the support from.
Okay, Mr. Stewart, and I'm glad that you brought those examples from a local perspective to kind of add context into the conversation. But speaking about conversation, sometimes men tend to dance the conversation about mental health, and there's a stigma with regards to mental health. How strong is this stigma in your view, based on your experiences and your engagement with some of the young men that form part of your initiatives and so on?
Well, men are silent on some of the things that they are going through, and because I think men are not as verbal with their challenges. You see, they said that men are loyal to their ego, because we don't want to admit weakness, vulnerability, failures, etc. We hold in so much, and we don't have a space that we can share some of the challenges that we do have. So the whole aspect of having to find somebody to talk with and to share what we're going through sort of brings silence to us. And then who are you really going to go to? Because when you go to the police station, in some cases, not in all cases, the kind of ridicule and lethargic response that you get, you can't go there. While there is a space for women when there is domestic violence, there isn't a real space for a man, certainly not in Tobago. And I don't know of any in Trinidad, and I may be wrong, where a man can go that this institution has put together to say this is where, if you are going through a domestic issue, this is where you go. So he cannot go there either. Even as men, man to man, if you go to a man to really share, these are the problems that I'm going through with my relationship, do you really have a sounding board that would be dispassionate to be able to put that man back on the right track? So there is that, along with the fact that even getting counseling, a man is a bit hesitant in going, because it admits vulnerability. Again, because he's loyal to his ego, he would not want to appear vulnerable in such a case.
One of our local artists, Voice, Aaron St. Louis, he recently released a song entitled Pray. And in this song, he spoke to mental health. But particularly, there was a part of this song where he mentioned the fact that although a man may be going through something and want to speak to persons within their safe space or safe group, they too might be going through mental issues. And that is a safe group that you're confined to. How does one maneuver through that kind of situation where you have your safe space and your WhatsApp group or whatever group, physical group, that you can speak to certain issues with regards to mental health issues and so on, but majority of the members, or if not all of the members in that group, whether it be a 3-member group or a 4-member group or even a 2-member group, they too are going through their own individual issues. In terms of the approach to maneuvering through those situations, what do you advise?
Well, a community of people in the same state would provide a measure of solace, but does it give you a way out? You need somebody who is brighter than you in a group for you to become brighter. You need somebody who's better off in a group for you to become better. But if what we tend to do is that we both going through the same problem, we become a community, we become friends and so on. So the most we could do is bounce things off of each other. While that has its own value there, to move to the next level, you need somebody who has either gone through it and come out of it and can give guidance as to the best way to come out of it, or somebody who's professional in it. And I suspect that many groups do not have the professional input to help men chart a trajectory out of their circumstances that they're, and a healthy trajectory too. Not the man who says, boy, don't let the woman treat you so, you must do her this and you must do her that. Not that type of man. The man who is going to say, boy, listen, this is the standard that you should hold. Regardless of what you're going through, don't fall below that standard. And at the same time, get the kind of help that you need. In my own aspect of doing personal counseling and personal development, when a man comes for help, there's a high chance the woman has left him. And when he is going through it, sometimes the woman would tell him, boy, get counseling, get help, let us go and get help. And he would say, man can't tell me how to live my life, because his ego continues to stand up and he refuses to go for help. But when water more than flour, then he comes in and says, boy, you know, the lady has left me and I need some help. But I think that we wait too late because we don't have the kind of counseling and support and guidance that we need at the time we are going through our stresses. And by the time the man comes, he is really stressed out. He is really burnt out mentally and tired emotionally, and almost at the point of giving up.
All right, so there are other issues that are affecting men besides issues with, that would lead to the suicides in terms of the frustration or the stress of trying to be a father, and in some cases denied, as you spoke to earlier. But there are other mental or medical issues that are confronting our men. Prostate cancer, you name the diseases, drug abuse, and other ailments that we adopt, and then we label drug abuse as a mental problem. But let's deal with the other mental health issues that men are confronted with, that we are reluctant. And you spoke about the ego, even to go and get a checkup. I mean, 2 days ago I went to the clinic there to do my blood, and I was a bit, it took a while for me to come to terms with, hey, you need to do an annual checkup. Let's talk about that whole question of getting rid of ego and to see about our health, because we think that when we go to those mental or medical institutions, we are less than a man.
You know, a doctor told me that many times when a man actually comes in to do a check on his health, is a woman who either more or less instruct him,
yes,
or support him to come in. So to see a man come in on his own, voluntarily, annually doing his checks is not something that is common. And that is something that we need to do. But here's what I hear some men saying. I prefer not to know. Because one of the things that the health department, the Vigo Regional Health Authority, has a blue room where the men go to, as you know. And one of the things that they've started to do is the HIV test and test for sexually transmitted diseases. And I was there with a gentleman when I went to do mine. And when he found out that you have to do that, or that is part of what is being offered, I'm not too sure it is mandatory, but certainly it is what is being offered, he insisted, no, I don't want to find out about that at all. I'm not taking that test. Now, there are sometimes that people think ignorance is better than wisdom, of knowledge. But let me tell you, there are many of the illnesses we can either prevent or control, manage, if we know it in time. But because we have this concept that we don't want to find out and we don't go for help, by the time we actually find out that we have an issue, it is far too late. I really want to encourage people to go to that blue room and get your health checked. It is going to do much for you in your own personal growth, development, and your family. If you love your family so much, you love it, the children and so on so much, do it for your sake and their sake.
All right. So let's break the ego barrier that prevents us from doing our regular medical checkup. All right. So and you're so right with this whole question. Some men don't want to know. Even when I was there a couple of days ago, when it came to the point where they had to do this particular test for AIDS, and I am there and I'm saying, I wonder, I know the outcome is going to be negative, obviously, but there are those concerns that people who live a lifestyle that does not fit in with their sexual health, because I'm circling that separately from the rest, because you have mental health, you have sexual health, and there are other issues, chronic ailments that contribute to diabetes and blood pressure and so on. But I'm trying to put into perspective, how do we get rid of the fear, or I prefer not to know, the ego that gets in the way, Mr. Stewart? That is critical, because that is what prevents the diagnosis. In some cases, we diagnose ourselves. And we say, nah, man, me I no sugar, I ain't going nowhere. Me I no blood pressure. All is ego bound that prevents us. How do we break that ego barrier?
I think that is where men like yourself and myself come in, where we go in and do our checks to encourage our men to do so. Because of the fact that I was diagnosed with prostate cancer and I had to go through the process myself, I use that as a platform to help men now to go and check. And one gentleman was saying, boy, it's hard to find out, because if you find out, it's a death sentence and so on. And then you have to live with that on your mind. Eventually, he took my advice and he went and checked, because he has always been scared he may have it. And when he went and checked, he found out he did not have it. But the joy on his face of knowing that he did not have it, that and all is worth going to find out, so that you'll at least be relaxed now that you don't have it. In another case, a lady called me from Trinidad when she heard that I had my challenge and I went and did surgery, etc. She said, I've been trying to get my husband for the longest while to go, but he would not go and so on. Could you talk with him? I spoke with the gentleman, never saw him, but I spoke with him. And I encouraged him. I said, listen, go and check, because your wife and your family very concerned about it. He did go and checked. And he found out that he had it, but in early stages. So she called me from the operating room, or outside the operating room when he was having the surgery, and said, Mr. Stewart, my husband took the surgery. He's inside. They just finished. They said it was a successful surgery. He's recovering and so on. And she was crying and she was saying, thank you so much for talking to him, because they said it was still organ confined and they found it. And boy, I'm telling you, just hearing that lady's voice, if that man could just hear that, another man could just hear that, you'll hear the relief on our families when we go and we do our checks. So one, he found out he didn't, and the other one found out he did, and he was able to deal with it in time. He's still alive today. He's now, for all intents and purposes, cancer-free, because he did the right thing. That's what we and yourself, Brother B and myself and all others need to do, to be there for men, to push them to that next level.
Because, I mean, and when I was there, obviously there were people who say, what am I doing here? As though, well, I am not a man too. Or someone who, in other words, he ain't supposed to be sick or have any concerns about his health. And that is the education, the information needs to be more present, maybe, I don't know. But just moving on to other ailments, of course, and staying with, men's health. Impotency and low sperm count is a real issue among men, Mr. Stewart. Couples break up as a result of these two. And let's separate them. Low sperm count in men. In some cases, the men are blaming the women that they are not fertile. And in some cases, it's the man whose sperm count is low. Where do you go to get your status? How do you encourage couples to treat or to speak to that, given that the man is the guilty party in this instance?
One of the things that as men we have to take note of is that our lifestyle also causes us to lose the sperm count that would be able to make us virile. And we need to watch our lifestyle, the things we do, the smoking that we're doing, and the drinking that we're doing, the kind of things that we're engaging in. Because more and more, and I can't talk too much from the medical standpoint, but I do know that those who have studied it say that some of the things that they would relate to would also reduce sperm count. And I think I was hearing recently that marijuana intake is also reducing our sperm count that we have. So when we look at that, it is important for us because let me tell you, if men are not producing and not able to produce children and the birth rate continues to drop, that has a lot of implication on us economically and financially, because with a drop in birth rate, any government becomes very concerned because your pension plan and all of that has implications, because if you don't have enough young people coming up in society, going out and work, paying taxes and all of that, then it affects those people who are living longer because healthcare has made us live longer. Some people going up to 100 years old. We're having so many centenarians because of healthcare. But if you are living longer and you're having to live longer on pension, but you don't have enough people coming up in the system, and you have attrition of some of our people going overseas to live, then we are going to have a serious problem. All right? And so that has to take into consideration.
I want to stick.
And, yes.
I want to stick one more, not to interrupt you at all, but, we were talking about that yesterday. Now, most of our young men, Mr. Stewart, unfortunately, are addicted to this drug, marijuana. You spoke about excessive smoking, and that can contribute to your low sperm count. In some cases, they are not in their productive, or they are not using their productive years productively, in that most of them, when you examine, they have no children and they have not, or maybe they have a girlfriend and they're trying hard and not aware that this drug is contributing to their low sperm count. Given that crisis, and you pointed so poignantly to the ripple effect of not having children by people who, population growth. What do we need to do? Are we doing enough as conscious people who are conscious like yourself, myself and others who are aware that we are losing our population because people, or young men in particular, are not aware of the damage that they're doing to themselves? How do we bring the awareness, Mr. Stewart? This is a job, I think, separately, that I think health professionals maybe need to do a lecture series, I don't know. You tell me what needs to be done to rescue our population from dying.
Well, we need a serious awareness program, and that has to come from a number of different quarters. The health sector happens to be one of those. But we have our International Men's Day, November 19th. We are looking to have the conference in Tobago for 2024. It was in Grenada in 2023, and it was a successful program. So we the point now that we are preparing a document to send in to the government and the Tobago House of Assembly to convince them, let's bring some awareness. And part of that is to have lecturers speak to that very issue that you spoke about there, to our men, so that we'll understand the number of different facets that affect us, including our health, our sperm count, and our reproductive health, etc. Because when we talk about reproductive health, most times we talk about women's reproductive health. But we need to start talking about a man's reproductive health. It is said that a woman is going to have a better health record because of the fact that by the time she sees a period, she goes to a doctor. At least I was listening to a doctor in last year's lecture say that when she sees a period, she goes to a doctor, and when she goes there, she gets checked on her blood pressure and everything. And when she gets to a stage of pregnancy, she sees a doctor again, and she gets all her checks done. But a man, really, there's nothing marking him for him to go to get his health checked until he actually gets sick. So the average man really goes to a doctor by the time he's a full adult and sick. And he says that's one of the reasons why we're in a worse health state as a man than it is with a woman because of that. So those things will come out in our conference that we are looking for in November 2024. And I know, Brother B, you do have a passion for that, and I think it is well justified, because we have to look at that. If we don't, if you know, many people, couples would like to be in a relationship and they have a child that comes out because of that. But if we don't have it, it has its own mental health impact upon us when we do not have a child with the spouse of our love. Right? So, yes, that will be addressed, and those are some of the areas that we could look at.
Mr. Stewart, so much of a man's self-worth or men's self-worth is linked to how much money he owns. He earns, actually. How do men find that? I mean, obviously, getting employment, becoming employable, those are specific options. But those who are struggling in that particular category there, where they're measuring the amount of money that they're earning with their self-worth and value. Just speak briefly in terms of maneuvering through that type of state.
Well, I think that it is falsehood and a direction that we to where we think that a man's value is in how much money he's worth. In years gone by, or my grandfather, my great grandfather did not work for much money. They were working garden, but yet what they did have, they were industrious. They were always ambitious. They work hard. So what you should look at is a man's tenacity to be able to work hard and find gainful employment and so on, to be able to take care of his family. That's what you look at, not the quantum of his money. Because there are some people, because they earn a lot of money, when a woman gets into a relationship with such a man, that man turns around at times to think he owns her. He has purchased her for the money. But if you get into a relationship with a man who is hard working, as our grandfathers were and our great grandfathers were, and they would bring up 8, 10, 11 children on garden money or on menial work, then you really have yourself a good man. Because even if the man works for plenty money, and if his worth is based upon how much money he makes, what happens if he loses that job, but there's a downturn in the economy and he has to be retrenched? That's why some men end up with another mental health issue, that I have lost my job, therefore I'm valueless. But that is not true. He still continues to be a father, he still continues to be a husband, he still continues to be a provider, even if he's lost his job. And that's where we need to get back to,
Okay.
in my perspective.
We got to leave it there, Mr. Stewart, and I tell you, we need to continue this conversation as to, promote our men and their lifestyle in terms of their health. And we want to thank you very much for being here with us this morning.
Thank you very much for having me.